Health Minister Dr. Christopher Tufton has admitted that the COVID-19 figures are moving in the wrong direction, but says the ministry is not surprised by the jump in cases. The health minister was speaking in Montego Bay, St. James earlier today, where he suggested that things may get worse in January. A positivity rate of 17.9% on Tuesday and 32.5% on Wednesday. An exponential increase in local COVID cases believed to be driven by the Omicron variant. But for Health Minister Dr. Christopher Tufton, based on the holiday activities, it's no surprise.
The increase that we have seen is in keeping with the overall national increase in positivity rates, and I'm going to give you some numbers which, in a sense, is in keeping with what we had said would happen going into the new year.
The minister explains that there has been a sharp increase in imported cases, and with the highly transmissible Omicron variant dominant in the United States, it's believed that the variant is now driving the local spread and pushing up the numbers. In the week of the 18th, the positivity rate was as low as 3.8%.
So it is quite clear that we are moving in the wrong direction. The reproductive rate is just under 2%, so it's well over the 1% or below the 1% that we would like it to be. The daily hospitalization rates have increased to about 45 persons per day, moving from about 36 persons, so that is going up. But in a sense, it is not going up as fast as the positivity rate is moving, which is again in keeping with the projections that this variant strain is not as lethal. However, large numbers will mean proportionally more persons likely to be hospitalized.
The number of positive cases among persons coming into the island has also increased, but Dr. Tufton insists that tourism is not to be blamed.
In the last 5 weeks, a steady increase was noted, and this week, so far, the imported cases account for 1/5, or just about 21% of confirmed cases. It is to be noted that this reference, however, to imported cases, just to be absolutely clear, is not confined to tourism or persons coming to resorts. We're talking about all travel coming into the country. So it includes, relatives and friends coming to look for their family members.
The health ministry had projected that Jamaica could see up to 1,500 new COVID cases by the middle of January if citizens were not cautious over the Christmas holidays.